This is the second video where we'll be looking at SLE and just a brief crash course. So SLE stands for systemic lupus erythematosus, and in case you haven't watched the previous video, the best way to think of SLE is you have the body mounting and launching an attack onto the body. Why exactly that was happening was due to different environmental triggers, and of course not forgetting that complements will be low, complements like C3 and C4, and also there's distortion in how the body identifies itself with the human leukocyte antigen, Dr2 and Dr3. So what we ended up having was a bunch of apoptosis happening, massive apoptosis, and these antigen presenting cells presenting these antigens to T cells, in which ultimately T cells led to the formation of antibodies against the body's own nuclear material. It led to the formation of anti-nuclear antibodies. Now, under normal situations, the body will be able to identify certain self-antigens through various mechanisms. Again, one way is through the human leukocyte antigen DRR2 and DRR3. But because this is distorted in SLE, it meant that the body can then begin to mount and launch an attack onto itself. And these antibody antigen complexes can literally be deposited in any system of the body, hence the S in SLE, the systemic part. Okay, so let's look at the virus systems that will be affected. And I kind of like to think of it as a person being exposed to a trigger, in this case UV radiation, and it has led to that brief pathophysiology that was mentioned. So starting from the head, what we would notice with the CNS, again, depending with how bad these complexes that are being deposited is, we'll see some sort of memory loss, behavioral changes, and psychosis is also a possible thing. Apart from that, seizures and even a coma, depending on how bad it is. Down to the hair, these patients are prone to lose some of their hair, and alopecia is a common presentation. A good question that you might be asked is on this manifestation is in this picture which is shown, and this is known as a malar rash or a butterfly rash. And notice how the nosolabia folds are being spared in this presentation. Another presentation that can be seen are discoid rashes, and the difference between a discoid rash and a malar rash is that a discoid rash is going to be scarring, and of course it's roundish. And lastly, at the level of the head, oral ulcers are another thing. So the thing to note about these oral ulcers is that they are painless. Okay, coming down to the heart, at the level of the heart, these antigen antibody complexes can go and affect literally any layer of the heart, leading to pancreatitis. Now, when it comes to the inner layer of the heart, the endocardium, leading to endocarditis, one thing to look out for, or a good MCQ question, is the type of endocarditis that is noted in SLE. So this is a non-infective endocarditis. It's known as Liebman-Sachs endocarditis. Liebman-Sachs. So it can affect literally any layer of the heart, hence the pancreatitis, which can be noted. At the level of the lungs, it can lead to some sort of thickening of the capillaries, leading to pulmonary hypertension, and of course not forgetting interstitial lung disease. Coming down to the kidneys, so SLE, again, these antibody antigen complexes can go up into the kidney, lead to some kidney damage, and this happens so fast. The presentation will be similar to a patient who has both nephrotic syndrome and nephritic syndrome. So things like proteinuria will be common, and also hematuria will be another common thing. Of course, not forgetting the body swelling and also the hypertension. This can ultimately lead to chronic kidney disease. So a famous person who had this was Selena Gomez, and she ended up having a kidney transplant. These patients will also be put on dialysis depending on how bad the lupus nephritis is. So this whole presentation is known as lupus nephritis. So just think of it as a combination of nephrotic and nephritic syndrome. It is a rapidly progressing glomerulonephritis. Okay, now we can go on to the blood. And again, the body can lead to formation of antibodies against its own blood. And so a presentation that can be common is anemia. So signs to look out for will be a patient complaining of palpitations and even easy fatigability. This will point you towards anemia. Another system that is affected is the MSS. And here, look out for some joint pains, look out for arthritis. Now, a good differentiation between the arthritis noted in SLE versus that of rheumatoid arthritis is that in SLE, unlike rheumatoid arthritis, there is no scarring or deformities that is noted, unlike that of rheumatoid arthritis. And another thing that can be noted is whenever temperatures are cold, either a patient is touching cold water or the environment is just cold, these patients are prone to have discoloration of their fingertips. This is known as Raynaud's phenomenon, as seen in the picture. And lastly, this is a pretty complicated thing, but these patients are also prone to get what is known as antiphospholipid syndrome. So this is just a state of hypercoagulable state. So these patients will be prone to have thrombotic phenomena, things like a DVT, pulmonary embolisms, myocardial infarctions, and a stroke are all things that are highly possible because of antiphospholipid syndrome. So when we talked about SLE in the first video, we kind of said that it would be more common in females because of estrogen. And so it will be important whenever a patient with SLE wants to conceive that they begin antenatal care really early, just because these patients, especially those at risk of having antiphospholipid syndrome, are prone to have miscarriages. And what exactly is happening here is that we have the placenta and we have basically the fetal placental unit. And remember that antiphospholipid syndrome is just like a hypercoagulable state. So some sort of thrombosis is taking place, and this is reducing the blood flow towards the developing baby. And because of this, these patients are prone to lose their babies. They will be prone to have miscarriages. Okay, so that was a quick and brief run through of some of the clinical manifestations and clinical features you'd expect in SLE. Again, just kind of think of it and divide it systemically. So we're saying that the antigen presenting cells presented to T cells, and then T cells lend to the formation of antinuclear antibodies. Of course, there are other things like B cells here, but just as a brief crash course, these antinuclear antibodies can literally go and deposit into any system of the body, hence the systemic part of systemic lupus erythematosus. Right, thank you for watching this video. Peace.